welcome to the Fountain House webinar series. In 1948, Fountain House has empowered people with serious mental illness to live and thrive in society. Our programs in New York City have provided over 20,000 individuals with serious mental illness a place to come, people to form meaningful relationships with, and a purpose that goes beyond the management of their symptoms. Today, we will hear Dr. Ralph Aquila share his experiences as a community psychiatrist and how the Fountain House community system of care delivers outstanding outcomes for people with the most serious forms of mental illness. He is joined by Nicole Pickett and John McConnell, who will share their personal insights from their many years of experience working with the model. Please welcome Dr. Ralph Aquila, Nicole Pickett, and John McConnell.
Hello from Fountain House. Today, as you heard, we're going to talk to you about our community system of care, an evolution over the course of a number of years between Fountain House and what has become the buzz, integrated care model. And we're going to get into that in just a moment, but let me introduce, as you already heard, Nicole Pickett here to my right.
Hi.
And John McConnell to my left.
Hello.
John, why don't you start off by talking a little bit about yourself?
Yeah, I'm John McConnell. I'm a member of Fountain House. Been involved with Fountain House since 1995. Working now as a peer specialist for Be Well, which is a corporation that was set up to help members with benefits and other things.
Nicole?
Hi, I'm Nicole Pickett. I have had the good fortune of working at Fountain House for the past 22 plus years. Many of those years I was a social practitioner and then a unit leader of one of our units here. And in the past 2.5 years I've been the Director of Managed Care Relations for Fountain House.
So I'm Ralph Aquila. I serve as Medical Director and also as the Interim Director of the Center for Leadership and Education, which actually brings you this series of webinars. And as I said earlier, today it's going to be about our community system of care, going beyond integrated care. So let's jump into the slides. And our first slide here, as you can see, is talking about schizophrenia. Now, obviously, we deal with many other illnesses, not just schizophrenia, but we want to use schizophrenia kind of as our base because, as many of you know, it is considered to be the worst disease afflicting humanity. And here you're looking at some numbers, some astounding numbers. 50 million people worldwide living with schizophrenia. And the costs, $32 billion around the world. And these numbers probably are a little bit on the conservative side because many countries don't actually take into account some of their most serious mentally ill. So I'm just going to get a couple of comments here from my colleagues. Maybe Nicole, you might want to just start in.
Well, I just want to say that these numbers are astounding. They, to me, are sort of unacceptable. I think we could be doing a lot better. And I think as we go along with this webinar, you'll see the incredible impact that our model has to these kinds of numbers.
John?
Well, the numbers are pretty staggering, and it shows, I think, the fact that mental illness is more common than people think. You know?
Yeah.
It's widespread.
Without a doubt. And if you add bipolar disorder, you're talking about at least another 75 to 100 million people, and increasing those costs and suffering that affects not only the individual with the mental illness, but families and friends and society at large. Mm-hmm. So clearly a humanitarian crisis. So here, another slide kind of going back, at least in the United States, you go back to the 50s, over 500,000 people in state hospitals. And then what we saw was what some people call deinstitutionalization. I like to say transinstitutionalization, where we took folks with serious mental illness and they end up in jails, prisons, the streets, homelessness. John, I think you can say a couple things about that, right?
Yeah, I've been in most of these places, including publicly funded psychiatric hospitals. I was in the state hospital in Oregon back in the 80s, and you know, it's a cycle that a lot of people go through. I mean, they get help for a little while, and their symptoms reemerge, and you know, the jails, prisons, city streets, and homeless shelters are, you know, full of people with mental illness.
Well, I think back then, if we knew then what we know now, and Fountain House started in 1948, so we started this model during this time of deinstitutionalization. And if we were addressing these social determinants of health that we are now, we would see a lot different numbers.
So we talk about this community system of care, and as you can see from this slide, what's the basis? It's the person, right? The person in the middle there. That's where we want to build upon, and we want to bring that person the resources. We want to bring them the opportunities to move on with their lives. What you see to the left is our clinic. It's our joint venture currently with a federally qualified health center. But what I want to underscore, and we'll repeat numerous times today, it's really about the community, because you can bring the best medical and psychiatric care to the table, but what's really important is to keep people engaged and help to see that there's more beyond their illness, that there's more beyond taking pills, that there's more beyond traditional psychotherapy. John?
Yeah, well, I received my services at the Baer Center, which is affiliated with Fountain House, but you know, that's only a small part of things. I mean, I see a psychiatrist there every few weeks, a couple of times a month, and but you know, the real work that goes on is just day to day. You know, I'm working here as a peer specialist, and you know, that kind of keeps me on my toes. You know, I'm able to help others, help people with entitlements, bring them to Medicaid offices, Social Security offices, and also to be there if people just want to talk about things that are going on with them.
You know, it's no longer acceptable, in my opinion, to just look at that person in the middle and just think about their symptoms and just think about their medications. I think it is essential, crucial to be thinking about their community. And in the next slide, we'll talk about this a little bit further, but we have to be thinking about the whole person and their whole lives, not just their illness, not just their symptoms.
So our vision, from way over to the left side of this slide where the person is defined by their illness, to the gradual progression to the right, till we get to the point where the illness is but a small piece of who they really are.
Yeah. I've had so many experiences over my time in the units at Fountain House, and so many people, it's astounding how many people would come in identifying themselves as this person with a mental illness and nothing more than that. And it has been my mission, and it is Fountain House mission to first start to help people to identify as a friend, as a colleague.
And that includes one of our film crew here, right?
That does.
Which
This
we wouldn't be
individual,
able to do this without him,
correct.
right?
He's someone who came in who lacked confidence in himself, who spent a lot of time at home playing video games, and now he's actually videoing us and working. And it's a prime example of what community, what the Clubhouse model, what addressing all of these social determinants and thinking about someone and having someone identify themselves as a person who can work and who can go to school and who can be a colleague and who can be a friend. And no longer is that that slice in the pie the whole thing. It is now just a very small portion of who that person is.
So talking about personal experience, this is a slide that I usually bring up whenever I'm presenting, but today I have someone here, John, who's gonna, you could always read this at your leisure for those who are viewing this, but I think more importantly, John, maybe share a little bit more about your journey.
All right. Well, I came to Fountain House in 1995. I was experiencing homelessness at the time and really just came here because, I needed housing. I didn't realize what else was here besides that. So I got involved in working again. I'd always worked since I was young, but in my early 20s to 30s, I had kind of stopped working. So I did a number of transitional placements here at Fountain House. To the point where, you know, I realized that, you know, I need to do something with my life other than just, you know, work in mail rooms and things like that. So I started going back to school, not right away, but it happened in a couple of years, and got a lot of encouragement here at Fountain House. I got my bachelor's in social work. Did an internship at a clubhouse in the Bronx at, actually, it's now Fountain House Bronx. It was something else back then. And then went on to get my master's degree. Had some setbacks after that, and kind of became disconnected with Fountain House. But about 5 years ago, I came back and started coming in again, and took this peer specialist job. It's been about a year since I've been working, and yeah.
Would it be fair to say that the community was a key ingredient in your recovery, in your second recovery, if you will, your second stage?
Yeah, it was. You know, having a mental illness can really knock a person down to the point where, you know, they have no hope, and but, you know, Fountain House kind of goes beyond that. You know, it helps a person get a perspective of themselves in a larger community, and what they can do to be beneficial to that community.
And thank you for sharing that. I know it's not an easy thing to do. It's hard to kind of open yourself up in front of who knows how many people, and this is also going to be archived, so I really appreciate it. Thank you for doing that. So you heard about Fountain House. Many of you are familiar with our history. I always like to kind of bring it up again. Maybe it's because we're a little proud. We go back to the late 40s when a group of patients from Rockland State Hospital, not too far from here, were identified as ready to leave. They formed a little group called We Are Not Alone. We used to meet on the steps of the public library, and then due to our first generous benefactor, started meeting in a house literally across the street from present-day Fountain House. And since then, as you heard at the beginning, we have served over 20,000 people, and that is a true legacy of who we are and what we're about. In our evolution, we had already been doing some things on an international level, but I think we kind of had a certain upgrade, if you will, when we were recognized by the Hilton Humanitarian Award. We were the first mental health program to be given that very prestigious award back in 2014. From there, we had developed a very strong relationship with the World Health Organization, specifically through Dr. Saxena, who was at that time leading the mental health component of the World Health Organization. And together with some others, created a two-pager, basically, best practices for addressing people with serious mental illness. A two-pager that was distributed to over 180 ministries of health around the world. We have since published a very important paper which basically identifies excess mortality in schizophrenia. It's actually one of the more cited papers in the literature, addressing specifically how not only is the psychiatric component the problem, but how actually the other medical diseases like chronic obstructive pulmonary disease, diabetes, hypertension, obesity are the most expensive and devastating aspects, to the point where average lifespan for people with schizophrenia is 15 to 25 years less. And here we are today. We have about 1,600 active members. The model has been replicated in 34 states in over 30 countries. But altogether, we're addressing maybe a little over 100,000 people. And as you remember from the beginning slides, it was over 50 million people with schizophrenia alone. So What's your thoughts
We
here?
have a long way to go. There's a lot more people who need community systems of care like we've created here at Fountain House to impact their lives. You'll see in later slides the amount of money that we've reduced costs, and it has, you know, really been determined finally, and we've known it for over 30 years, longer, that these social determinants of health that we help people with really impact and improve people's lives.
John, any thoughts?
Yeah, in my early days at Fountain House, I remember a staff person said to me, look, you know, take this place for what you need it for. You know, it's a resource, you know, and I've traveled quite a bit with Fountain House, seen a lot of clubhouses in different states and other countries, and
We co-presented in 2004 in Hong
in
Kong.
Hong Kong,
right?
right,
Yeah.
right. So,
So here is kind of what we are addressing today. You heard some of the wonderful things about Fountain House. So over to the left of this slide, the buzz, right? Integrated care, integrated medicine. What does that mean? You bring a behavioral health specialist into a primary care clinic, or you bring a primary care clinician into a behavioral health clinic, and voila, that's supposed to be the answer. Well, I think for certain people, it may be. If you have anxiety or depression, mild form, yeah, maybe having the two together and reducing the stigma there and getting the help you need could go quite a ways. But when you look at people with serious mental illness, like with schizophrenia, and you hear the numbers, and you hear about the other medical comorbidities, and you've been literally kicked in the pants, literally and figuratively over the years, it's hard to put your trust, it's hard to follow a certain pattern. And to just see a doctor once or twice a month, or a clinician once or twice a month, really isn't going to address the employment that we all want to be part of, right? The education, the wellness, talking about nutrition and exercise, the relationships, which is the essence of what Fountain House is about, the benefits, the housing piece. I mean, all of this is really what keeps people going and keeps people in treatment so that they don't end up getting more ill, ending up back in hospitals or prisons or whatever. And this is our definition, and Nicole has already alluded to a number of times, the social determinants of health. I don't care if you're the best endocrinologist in the world. Your patient lives in a food desert, right? They're not going to get better. I can tweak that insulin all you want, but if all I have to buy in my neighborhood is sugary and fatty products, I'm not going to get better. So
This
few
notion
thoughts.
of integrated medicine and just addressing these two, the psychiatric and medical needs, is just simply not enough. It is proven time and time again that these social determinants actually improve those other things. So if you have someone who has opportunities for employment, has opportunities to improve their education, to increase their chances of employment, to address these wellness goals and improve their relationships, have community, and have, of course, housing support, it is essential in helping people to reach their potential and move forward in their lives. And I think at Fountain House, you know, we've been doing it for a number of years. It just comes, it's natural for us. I think it's a fairly new notion in the world of psychiatry and medical health to be thinking in the mental health world that these social determinants are important factors. So I would just say, as a social practitioner, you know, I am charged if someone is not in our community system of care, they're just receiving Fountain House care and seeing other psychiatrists, we're very much involved in their medical care as well. And I would charge all of you to if you don't have that for your members, that you should, and that you should try to help them to receive psychiatric care that welcomes people that have relationships with them to be involved in their care.
John, as someone with lived experience, and now as a kind of social practitioner.
Right, right.
What's your thoughts here?
Well, people don't exist in a vacuum, you know, and there's, if one tends to focus strictly on your illness, it's kind of a narrow view of things. So through a place like Fountain House, you're able to touch on a lot of different aspects of your life, you know.
Can I also just say, Ralph, you know, from the psychiatry end, you know, if you're a psychiatrist or a medical doctor who are working with people with mental illness, I think you're also charged with trying to build relationships with communities like a clubhouse. But if you don't have a clubhouse in your community, looking at other programs that address these social determinants and partner with them to make sure that you are serving your patient in the best way possible, that you're looking at the full picture.
Right, and I'm glad you brought that up, because we don't want this to be a commercial for Fountain House. I mean, we're obviously very proud of what we do and the history here. But what our whole point is, to go even beyond, and what we hope our webinar series is going to do, is to go beyond just clubhouses. And we really feel strongly that these kind of partnerships can be formed under other instances.
Absolutely.
Whether it be your community, it could be your church, your synagogue, your mosque, it could be a social gathering, it could be through a senior center. But what we're trying to encourage is the notion that if you're going to work with people with serious mental illness, that you're going to need more resources. And I'm going to just say real quickly, as a psychiatrist, for me, I never would have been able to do this work. I would have been just one other burnout, because it can be very frustrating. But when you have a community like ours, or like another one that you can create, it makes it just so much more rewarding, because we're not just focusing on the pathology, which is our mission, right? But we're also focusing on the successes, right? I heard earlier somebody got their first paycheck after a number of years, and how proud that person was. That's one of our film crew again. And those were the kind of things that just really gives me the buzz, because you know, there's so many things that make you upset in the health and mental health world. Mm-hmm. All this clicking, all this documentation, these electronic medical records. But when you hear members and their success, I mean, it kind of helps you get through all of that.
So, you know, Ralph, you're talking about needing the clubhouse to be able to do your work. Well, on the other hand, clubhouse also, you know, I've been working with the Sidney Bear Center and with Ralph for many, many years. And, you know, we see individuals, some people come in once a week, some people come in once a month, some people come in every single day. And we're able to notice when there's changes in someone's psychiatric symptoms, or if there's issues going on with their employment, or they're struggling with their education. And it's been incredibly resourceful and incredibly helpful to be able to have access to their psychiatric and medical care, you know, sometimes at a drop of a hat when it's needed. That relationship between medical care and these, you know, social determinants in the clubhouse is an essential ingredient to success.
So a little bit of numbers always helps. So we did a study with NYU looking at, in particular, high utilizers of resources, which oftentimes is a large proportion of people with serious mental illness. And what we found was that together with our community system of care, we were able to reduce costs by over 21%. And now in your role as kind of our public
Managed care person?
Yeah.
I mean, these are the numbers we've been known all along, and it's nice to see that a study has been done and we're showing it. I think in the state of New York, you know, we're finally in Medicaid managed care. Managed care organizations are paying for these types of services, and the clubhouse would even reduce the costs even more. From these, you know, high utilizers of care, and you see it by the 21% decrease.
So I'm going to put this up and ask you, John, to start talking a little bit about this, because as you said, through your lived experience, you've kind of been through a lot of this, right? You want to go over this slide?
Yeah. Homelessness, you know, like I say, I experienced homelessness before I came to Fountain House. When I became disconnected with Fountain House, I ended up homeless again. So,
So, you look at the numbers, 40% for the
40%.
general serious mentally ill versus about 1% for ours,
Right,
right?
right.
Rehospitalization, which you've also been through, right?
Yeah, yeah.
50% for the general, 10%, a little less for us. Incarceration, you've been there unfortunately,
Right,
right?
right.
24%, and that's a real shame on us, right? 24% of people in prison have a serious mental illness. Now, if you put in other mental illnesses like PTSD and anxiety, it goes up to as high as 50%.
Yeah.
And we're at 1%. Employment, this is on the positive end, you've been on that side, right?
Right, right.
So average numbers for people with serious mental illness, in particular schizophrenia, is at 85% to 90% unemployment rate versus a little over 60% for us, or 42% employment rate. And then our education, which you also have been a key person that's benefited from that. 77% of our members have gone back to school or some kind of particular skills training. So not a bad piece of data, right, Nicole?
An excellent piece of data. I mean, I think it's, when you look at, I'd like to go through all of them.
Yeah.
Homelessness, so Fountain House, a long time ago, realized the importance of just a baseline roof over someone's head. This is a basic need that affects everything. And so we made it our mission to create a housing program, a fairly robust housing program that has all types of different housing. And so if you're a clubhouse out there that doesn't have a housing program, and you have issues with folks who are homeless, I charge you with the importance it is to find the resources and apply for grants that will allow you to have a housing program for your membership. The rehospitalization, I mean, I'm surprised it's not even lower than 10% actually, because, Fountain House is not a place where someone graduates. When someone becomes a member of Fountain House, they're a member for as long as they wish. And when someone is hospitalized, we visit people in the hospital, we maintain those relationships, and we hope people will come into the clubhouse as soon as they're discharged. Sometimes we're even there for the discharge. And so the reason people their needs are being addressed immediately upon discharge from hospitalization, and that's why that number is so low. And incarceration, again, we're giving people so many different opportunities to improve their lives that the 1% is not a surprise, because people are doing productive and useful things with themselves. Even if they're just coming to the clubhouse, if they're not employed, they have a community of people who they have strong relationships with, who helping them to lead productive paths. And then, we have a very large employment program with many transitional employment positions throughout New York City, and a very, very large educational support system here at Fountain House.
So, more numbers. Again, I always think numbers are important. You see the cost of keeping somebody in prison, not to mention the risks, suicide, physical violence that goes in both directions, both from the person with serious mental illness to the custodians. You look at an average 2-week stay in New York State, $28,000. $28,000 with a relapse rate of 50%, and the fact that over 50% of patients discharged from an inpatient unit never make it to their first outpatient appointment, which you were eloquently underscoring earlier, how we're even involved sometimes in discharge planning when our members end up on an inpatient unit. And you look at our costs, just for the clubhouse, about $4,200, right? But that provides all the resources, the assistance with employment, education, the benefits components, the wellness. If you add on the housing, we're almost $25,000. But again, a lot of that money, sometimes people are employed, it's a third of their income. So it's not all public dollars. And John, you've experienced the right side of this slide. You've experienced what it means.
Yeah.
What's your thoughts
Well,
comparing these? You've been on both sides of this slide.
And on both, yeah. Well, it's pretty simple. I mean, you can stay out of places like hospitals and jails and institutions by becoming involved in a place like Fountain House,
Right.
And that includes treatment for substance use, which I've had a problem with over the years, And,
You know, I would like to add a factor here, the misery factor, right? I mean, I know that's not commonly used or thought of, but think about the horrible situations of being in jail with a serious mental illness, of bouncing in and out of hospitals, ending up in an emergency room. And every relapse, I mean, it's not just the hospitalization, right? I mean, when the authorities get involved, the risks for all involved, right? Of people ending up getting physically hurt or killed. I mean, these are staggering numbers and really scary moments out there as compared to the vast majority of our members who not only are moving forward with their lives, but are actually, I dare say, happy,
Yeah.
right?
Yeah. And we're in the process of really looking at loneliness, and we're so fortunate that we have this amazing community. And the studies aren't out yet, but I would say that the loneliness is reduced exponentially by being involved in a clubhouse.
Right, and furthermore, we know isolation and loneliness kills. I mean, in the UK, they've actually created the Ministry of Loneliness because they see among seniors in particular how loneliness impacts on overall quality of life and life expectancy. So these are really important factors that we're talking about. So Fountain House, clubhouse world's been known for the work order day, but I think it's important to talk about education. And through generous grants of the Sidney R. Baer Jr Foundation, we have our mini scholarships here at Fountain House, which go a long way in helping people with their essentials of getting back to school. And then we're part of, as Fountain House, we're part of these national scholarships, where what you see is an 82% graduation rate, a 3.7 GPA average, compared to a 50% graduation rate and a 3.2 average GPA. And what this really talks about are, yes, some of the best and the brightest, but it just, again, talks about what's possible, right? That schizophrenia does not have to be a dead end. That bipolar disorder doesn't have to be a vicious cycle. And I have someone sitting to my right who's actually a recipient of this scholarship. You might want to say a few words on how that helped you.
I received the Reintegration Scholarship in, I think it was about 2008 or 9. Before that, I had gotten some smaller scholarships, and along with financial aid, did well in school. I got my bachelor's in social work and then my master's, and got a lot of encouragement from members and staff here at Fountain House, which helped. You know, I think it would have been harder for me to do it alone. I could have done it alone, but it wouldn't have been as easy. So school went pretty well with the help of Fountain House members and staff.
There's been so many members of Fountain House who have tried to go back to school prior to being members of Fountain House. You know, many times it was like they didn't have a person to support them. They didn't have the person who was their cheerleader, the person who, you know, helped them to apply for the school and get scholarships and get financial aid, the person who helped them register, the person who helped them manage their time and look at the syllabus, and helped them to have a quiet study space, a computer to use to complete their coursework, to help them from the very beginning till the very end. And that's why you see that graduation rate at 82%, I think.
So this is, I think, one of the most important slides that we've shown, and we're coming down to the end here. Our focus across the entire lifespan. And I want to make an important point. I mean, we're focusing on the Fountain House model, we're focusing on people with serious mental illness, but regardless, we all need support. I mean, I wouldn't be where I am without my family and friends and my networks that I have had over the years. And we're not saying that people with serious mental illness need more or less help. We're simply saying that the community system of care, the community that Fountain House brings, or again, any community, but no person is an island, and we need supports. And what you see here is from the youth program to an actual wedding day picture of one of our members, to our Silver Project, where we're now focusing on seniors like myself to be engaged and to be involved, because we know that as we go through the life cycle, we're going to need different levels of support.
I think one reason that we are so successful is because the clubhouse is a membership, a place with membership. There's no graduations. We're able to work with folks through the course of their life if they want that. I know people that have, I'm dating myself, I've been here for 23 years, or close to 23 years, and known individuals that have been members of Fountain House who have had successes throughout their lifespan, and who are now a part of our Silver Center. I think it's an essential piece to what we do, that people are able to utilize the clubhouse and what we have to offer at any stages of their lives. And if they have a period of not being involved, they're able to come back. That has shown huge success and why we have the numbers that we do.
John?
Yeah, there's no doubt in my mind that I've had and continue to have a fuller life through my involvement in the clubhouse. You know, it's you know, I've always been close with my family and always had friends, but Fountain House has given me a lot more, which helps. Yeah.
Community.
Yeah.
So as we wind down, kind of to summarize, we talk about going beyond integrated care. We talk about the case for community. And as we said, Fountain House is but one example of what community can be, but we feel very strongly through the data that we showed you that we are in a real humanitarian crisis here. And what needs to be done, whether it be in high-income countries or whether it be in low-income countries and everything in between, we need to figure out how to provide community. And just as a quick plug for the Center for Leadership and Education, which, as I said earlier, are sponsoring these webinars, we believe we have a moral imperative to the world to assist whomever and wherever people might ask us for assistance. As you heard, we've been doing this for over 70 years. We think we've come across some very interesting recipes for success, and would like to be there for whomever wants to do this. And again, Nicole, you talked about reaching out and forming partnerships, whether it be with the mental health world, or whether it be with other communities that want to help provide supports for people in particular with serious mental illness.
Yeah, I mean, we believe that the most success and the best formula is with the clubhouse, and with a clinic that offers psychiatric and medical care, but it doesn't have to be that. I would really say that, you know, if you don't have those components to do everything in your power to create those relationships and those partnerships, so that you can see your members, your patients move forward in their lives, and you know, put a dent in those costs, and have happiness and a quality of life and reach their potential.
John, any closing thoughts?
Well, I think as Ralph said, you know, we realize we're not the only model. There are other ways of getting a person well and helping them with the recovery, but I think, you know, I think Fountain House is definitely on the right track, and you know, the fact that the model has been duplicated a lot of times, and like I say, it's not the only model, but you know, what goes on here can, you don't necessarily have to have a clubhouse in
Right.
order to do a lot of what we're talking about.
Correct.
You know,
Right.
Clubhouse just makes it easier.
Right. And what we're talking about is even embracing some of the elements that we shared with the audience today, and then building upon that. And then when one wants to go ahead and actually go through the entire accreditation process, again, we can help whomever is interested in that. But I think the notion that goes beyond just an integrated clinic and where the community is really the essential component of helping people move forward. So I think we're gonna stop there, where I think we'll thank everybody for their kind attention. And if I'm not mistaken, we have questions coming through, so.
That is absolutely correct.
Okay,
So again, thank you all so much for that insightful presentation. We are moving on to our Q&A portion of the webinar. First and foremost, what does it mean to be a social practitioner? Just for a matter of clarity before we continue with your other questions.
You know, we define social practitioner as somebody who is engaging people in the work of the clubhouse. We are developing relationships, real relationships, not professional relationships, but real, true relationships with our membership, and helping them to work toward their goals, to see that there's more than just being a patient and being somebody with a mental illness, but to see themselves as a friend, as a coworker, as a neighbor. And so we call ourselves social practitioners rather than social workers or clubhouse workers.
I would just add that I think it's a very highly professional group, our social practitioners, but with the difference of the notion that the person in front of them is your colleague, not your client,
Not your client.
not your patient,
Correct.
right? And that's why we talk about memberships. But I feel very strongly, as I guess, as a psychiatrist, saying that what I have seen over the years, social practitioners here are extremely professional and extremely engaging. John, I don't know if you have any thoughts on that. Because you are one yourself.
Yeah. Well, I have, I when I first heard the term social practitioner, I kind of thought, oh, what is this? Why not social worker? But I think a lot of what I've learned here at Fountain House translates into my work, and that is, being a colleague with the person you're working with.
Right.
Not that client,
Right.
client, expert to client
Right.
relationship,
Yeah.
more of a level playing field kind of,
We work in partnership.
Yeah.
Correct.
Excellent. And so John, this is a question specifically for you from one of our participants. They asked, what was the pivotal motivation for you to climb out of your schizophrenia? They are currently dealing with a family member who is deep in the media phase that you just mentioned during the presentation. Thank you.
Well, I don't have schizophrenia. I have bipolar illness. But what was the turning point? Well, coming here was one turning point, but then I relapsed both with substances and mental illness along the line, and I guess it's kind of a culmination of experiences and getting tired of living the way I was living, so it had to come from an insight that I had myself that was helped by others, but nobody ever yelled at me and said, you have to snap out of it because it's not so easy, but being in a supportive environment and being given some opportunities, I think was a turning point for me.
Great. Another panelist asks if you can tell us how Fountain House engages with family members.
I've had many experiences over the years where family members may not understand an illness or may not understand what someone's going through. And if the member is interested in engaging with their family and having Fountain House engage with them, then we are certainly welcome that. I know many times I've been at the Sidney Baer Center at someone's appointment, psychiatry appointment with them, with a family member, and so we're all working. Ralph used to call it a three-legged stool, and that way it might be a 4 or 5-legged
Right.
stool, and that happens all the time. And again, this is about community. So there is a clubhouse community and their community and their relationships with the family. It's all integrated. It's all part of someone's entire life. So we find that very important in working with folks.
So I would just add that, for me at least, the most important aspect is bringing as many resources to the table as possible. So clearly, our social practitioners, our community at large, but then we're going to expand to, if the housing is not our housing, we're going to talk to other housing providers. We're going to obviously bring in families whenever, families or the members' consent, we're going to bring them in. Because we know that the more people, you know the old saying, too many cooks spoil the broth? Well, our motto is, many hands make light work.
Right.
So we're always looking for more resources to really engage and give hope to that individual, the identified quote-unquote patient, to go beyond the patienthood as you saw earlier, right? Where it's not just the mental illness, it's about the whole package. And that's what's so important about engaging families and whenever we want to have them in the room.
Great, thank you very much. Just a reminder to all participants, you can continue to submit questions into the chat function during this Q&A session. Our next question asks, when you say Fountain House can provide support for programs interested in creating this community system of care, what do you mean?
Okay, there we go. So the question was, you talk about providing help for programs who want to become clubhouses or already existing for more support. So I think through the Center for Leadership in Education that we have been expanding and continue to grow. We have a number of people that are available to talk about whether it be creating a new clubhouse or even looking at forming partnerships. So our suggestion would be that you reach out to us either through that email address you see there, or you can call us directly at our Fountain House number, and you can see that at fountainhouse.org at our website. But we certainly want to help. Are we always going to be able to? Well, that is TBD, to be determined. But we certainly feel strongly that we've got the experience and the technical know-how, especially even through our WebEx program now, where we're doing long-distance learning and long-distance communications. We've been doing that now internationally and nationally. So I think the real answer to that question is reach out to us and let us start a discussion rather than me just throwing things off the top of my head. I think engage us, let us know, because we would love to know what your particular situation is, and then kind of see if we can consult and help you with identifying what specific resources to help you with. Or if you want to add anything, or John, if you have any thoughts. But that would be my recommendation. Reach out to us directly and let us help, if we can, see what best can be done.
Thank you. Is there an aspect of the community system that is more important than the others?
I would say not. I think they're all equally important. I mean, I think the community, the clubhouse community, and what we do, and the opportunities that we provide our membership are really essential. You know, the one and I think the medical and the psychiatric side are equally as important. So they really go hand in hand. I wouldn't say that there's one more important than the other.
John, you want to say something on that? Or I do. As a psychiatrist, right, even though now my role has changed and I've become an integral part of this community, I think state-of-the-art medicine and psychiatry are key, without a doubt. And do I want to say they're more or less important? I think that's semantics. But I firmly believe in my heart of hearts, after doing this for 30 years, that without community, and again, we're not doing a commercial for Fountain House. This is one modality. I mean, there are some people with just their family alone maybe can do it. We said no person's an island. But I do really believe that some form of community is the essential ingredient. Because without that, it's hard to stay the course. It's hard to have any kind of long-term illness and have to deal with it without the supports. Because your clinicians are going to be there for you once or twice a month. They're going to be there when there's an emergency. But they're not going to be there when you're going through a bad day. And all of us have a bad day. And I just feel that the community...
We're really going to contribute to your happiness and your fulfillment of life,
Right.
and your hopes and dreams of, getting a job and, having a best friend and maybe finding a wife and, all of those things. Those are, those can't really be addressed in the medical and the psychiatric clinical side.
So, which is more important? I'm gonna lean towards the community.
Thank you very much. And what do psychiatrists need to know about creating a community system of care in their own communities?
So, I would start by saying that knowing how people are doing besides that 15 to 30-minute Q monthly visit, because people can come into the doctor's office and not be who they really are the rest of the time. I mean, the community sees people maybe, who knows, 5 days a week, 6 days a week, and has a broad vision of what's going on. In the clinical realm, you're seeing a small sliver of the person, and you really don't know what goes on afterwards. While as the community, and it could be the families, it could be the housing providers, they have a much broader view of what is actually transpiring. So that has always been, for me, the luxurious part of doing what I have done for the past 30 years, where I get all this subtle information, both good and bad, and which allows me to really enjoy and perform in a better way.
Yeah, so I would say as a psychiatrist, bring a significant other for your patient in to those appointments with you. Get feedback from the people that they have close relationships with, to have input on how things are going for them, and address those other social determinants and how those things are going, not just the symptoms of the illness.
Excellent. Another question has been asked, asking, will this model work for illnesses other than schizophrenia?
I mean, Fountain House works with individuals, pretty well across the spectrum of mental health conditions. So, and I think Ralph is using this as an example because of the astounding numbers, because it's one of the severest of illnesses that afflict so many people across the world. But yes, this does work for people with all mental health conditions.
Well, John identified himself as having bipolar 1. We've been working with major depression for many years, and everything in between. What I would like to underscore is that we feel strongly that our best comes with people with serious mental illness, and we generally define that as schizophrenia, bipolar disorder, and severe depression. But could the model be applied to others? Without a doubt. But we want to maintain the focus that people with serious mental illness worldwide are not getting the resources that they need. While as some other illnesses like post-traumatic stress disorder have been getting a lot more support and a lot more resources, in large part thanks to our brave men and women who have fought overseas in the various conflicts that we've been involved. And you all know about the rate of suicide amongst veterans. But our emphasis, especially in the last few years, has been really to focus on those individuals who seldom get the quality care and supports that they need.
Well, thank you all so very much. That concludes our Q&A for the day. If you have any additional questions regarding this webinar or any past webinar that the Center for Leadership and Education has put on, please reach out to the Center for Leadership and Education via the contact information on the screen. You can also visit the Fountain House YouTube channel to view an archival video of this presentation as well as our previous webinars. Please log in to fountainhouse.org/webinar to register for our next webinar, which will focus on the topic of employment. Thank you all so very much and have a wonderful afternoon.